Well, Senator Stabenow and I are both glad to be here. We're glad to see what we think is a significant step in the right direction. As she mentioned, after the tragedy at Uvalde, as is always the case, the first thing that almost everybody says is, well, the mental health system isn't working the way it should be. And we both, we immediately talked to each other, and then we started calling everybody who was working on putting a package together to explain that we did have a system that was working. And Secretary Becerra, thanks for your leadership in this and your friendship and the time we all three worked together in the Congress and working together here. Assistant Secretary Delphin Rittman is doing such a great job on this. Administrator Brooks LaSure, we worked with on many other things, but now in your job at CMS, so critically important. Excellence in mental health, you know, treating it like mental health like all other health, so critically important. Debbie mentioned we had 8 states initially, and then we quickly were able to add 2 more. But what we're focused on are facilities. It took me a long time, as Caitlin Wilson, who's here, who was my principal staffer on this in the office, would know, just to get the acronym right for, you know, Certified Community Behavioral Health Centers. I called it the Excellence Act for a long time until we finally got to where we were really using that in all of our discussions about what could happen here. Places where you can go 24 hours a day, 7 days a week, 365 days a year, that had the kind of staff that the law requires you to have, not only the complete availability, but also staff that's available to do what needs to be done. You know, NIH, the National Institute of Health, for a long time has used a number that generally something like 1 in 5 adult Americans has a diagnosable and almost always treatable behavioral health issue. 20% of the adult population, my guess is, after the last few years of COVID and isolation and other things, that number is probably about the same for the total population. How do we deal with that in a better way than we'd been dealing with it? So we started those 10 states, and then we decided we could actually expand that to units that met all the criteria, the qualified criteria that could do what those states were doing, basically statewide, in often largely bigger communities. 300 communities now have CCBHCs in them. 40 states already, including the 10 pilot states, have some element of this program. They know it's working. They know that the finance structure based on the federally qualified health center structure works. It's not just for Medicaid patients, it's for everybody. You know, the way those facilities work is if you've got insurance that covers you in those facilities, you can go there. If you're under a government program that covers you, you can go there. If you don't have any of those things, you can go there, and there's a very manageable sliding scale so that if this is a facility that's close to you and available to you, you can use that facility. Telehealth also works particularly well with behavioral health. You're more likely to be further away from your behavioral health provider than you are your other health provider. Making all of that come together in a way that keeps people in the community, that keeps people with their family, that keeps people at their job, all that critically possible. And here we are, as Senator Stabenow mentioned, 59 years ago this month, the bill was signed that these big facilities would be replaced with facilities that were in your community that were going to meet your needs in a better way and allow all of those things to happen. We now have the possibility for 50 states, and we're going to talk about how that happens in a minute, for all 50 states to take this big step forward. Law enforcement for too long and the emergency room. Law enforcement in the emergency room have really, for most of that 50 years after those big facilities got closed in the 70s, became the de facto mental health delivery system for the country. Nobody is well served by that. Law enforcement isn't well served by that. The emergency room is not well served by that. And certainly the people that need help in that crisis moment aren't well served by that. Brent McGinney's here from the Missouri Behavioral Health Council. They've kept really good records, not just of the mental health efforts going on, but also the difference it makes in people's other health. Senator Stabenow mentioned that hospitalizations were 72% lower. Those hospitalizations are often not lower because they would be in the hospital for mental health. They're lower because if your mental health is in a good place, you show up for your other appointments, you go to dialysis, you take your medicine, you eat better, sleep better, feel better about yourself, and you don't wind up in the hospital for the other health concerns that can put you in the hospital. There is a dramatic decline in what happens in people's overall health if you're dealing with their mental health. That's an awful big part of the 72% reduction in hospital visits. Aren't hospital visits that you would have made hospital stays for mental health, but hospital stays you would have made for your other health concerns that you weren't dealing with because your mental health concern wasn't being dealt with. 9 years ago, we were talking about that bill that had been signed 50 years earlier. Senator Stabenow and I both couldn't be more happy to be here to see us at this moment. We know this works. We know the difference it makes in people's lives and the communities they live in. And it's a great time, and certainly one of the people that will be incredibly important in making this work is Dr. Miriam Delphin-Rittman, who will be here to explain from her point of view the nuts and bolts of how this works, of how states can apply, how they can be in that 10-year effort where we're hoping at least 10 states every 2 years will join the 10 states that are already making this program work and know it works. And Dr. Delphin-Rittman, thank you for all you're doing to make this work.
Thank you.